Dr. Jomsi, Dr. Abel, Johnson Aramula, my friend Ashok, and all my dear young friends. I'm very happy to be here on this day. And I know you have been already informed about what is going to be presented. So I assure that my presentation will be a brief presentation. I'll not take much time, but I'll leave enough time for interactions, which is more important. So I'll not be a radio, we'll have interactions. I have a few PowerPoint slides. Yeah. So this is a question I wanted to discuss here. Usually we ask this question to high school students when they are in the phase of decision making. You want to become a doctor, you want to become an engineer, these kind of questions. And of course, I know, all of us know, we are from Indian families. Most of the families, they want their children to become, if possible, doctors. Now IAS, all those things are coming up. So now I am asking you guys, you are already into medical studies, you are all medical students. I am asking you this question. Is medicine the only career option for a doctor? I'm not saying that none of you might have thought about other options, but that's not the general nature. That's not the norm. That's even now those are exceptions. So I thought this is what I do. Actually, I got some insight a few years ago when I came from US to India for personal reasons or official reasons. I happened to address a group of medical students like this in one of the government medical colleges. So I asked them some questions, and those questions gave me a lot of insight. That's why even before that I used to come as a kind of motivational speaker for medical students, and I thought I was motivating everyone. So after my talk, everyone is getting motivated. But a few years ago, I asked some basic questions, which changed my perceptions and which changed the way I talk to medical students. I'm asking you a question. Did you really want to do medicine? Be honest. How many of you really wanted to do medicine? Can you raise your hands? No, you guys are honest. But numbers are good here compared to the other government medical college where I did a lecture a few years ago. My next question is, do you enjoy doing medicine? How many of you can raise your hands? I'm really happy you guys are very honest. I'm very happy that you guys are honest. But we'll discuss these things also, how to make those who want to become doctors, how to make this interesting. That's why I told, even before I started my presentation, I told Johnson that, no, I'll be happy to come over, talk to students, teach some of the topics that I have learned, and those experience that I have living in different countries, traveling to different countries as a WHO officer and other officer of other organizations. I have more questions. Who chose medical career for you? Yourself. How many of you can raise your hands? Good, good, good. Parents? Yeah, I know. But don't be reluctant. Don't be ashamed of raising your hands if you want to tell the truth. Relatives? Teachers? Society? For me, it was my teachers who started telling me, because I was a good student in biology, they started saying that, no, you should do medicine when I was in high school classes. Of course, I know all these pressures, society, I talk about society. Just because you live in India or Kerala, you have that pressure to become a doctor. That's a fact. So why did you choose medicine? Again, be honest. Passion for medical science. How many of you? Good. You guys are honest. I like it. Service to society. Great. Job security. Like it. Money. Be honest. Yeah. Social status. And how many of you say that all the above? All hands up, right? And I'm sure there will not be anyone with the opinion, who will vote for none of the above. So, medicine is a great profession, no doubt about it. People like me or Johnson or senior people who are still alive, because there are doctors, good doctors. And I also, as a doctor, I also have practiced for some 10 years. I also have saved lives. I also have saved lives in airplanes. When you travel, somebody falls sick, they will announce for doctors. So I have done that. I have very interesting stories. Some of you might have seen those videos in this Charitra Menilude in that Sanjari channel. So there are opportunities. So it's a great profession. Kerala is very different in terms of health. We are very unique compared to other states of the country. Our health indices are very close to developed world. All those things are there. So of course, medicine has contributed. Kerala has highest life expectancy in India, or lowest maternal mortality rate, or lowest infant mortality rate, not because we have medical doctors, we have medical college. We also have contributed, but there are other reasons also. So we can discuss these things when we have time, or you can ask us questions. And when we think about doctors, we always have the picture of somebody who's hanging stethoscope over the neck and those kind of, or somebody sitting in a clinical room, or somebody doing operation. But there were great doctors who did wonders. And some doctors who changed the world. Who is Edward Jenner? First picture is Edward Jenner. Who is he? First vaccine, right? Because of him, many people got saved. They would have died very young. Who is the second person? Daniel Hall Williams, first open heart surgeon. So those days textbooks did not have even proper medicine. All these advances were not there. So people even thought about doing heart surgeries those days. Even now it's a big wonder. When one of the medical college does a kind of heart transplant. A few years ago, doing heart surgery in medical college was big news, title news in newspapers. Kottayam Medical College has started heart surgery, something like that. Or I was a student of Trivandrum Medical College when we started open heart surgery in Trivandrum Medical College. So these are not long past. So who is the third person? Alexander, who is he? When I was making these slides, I was thinking of a situation. See, because of Alexander Fleming, many of us are born just because of Alexander Fleming, who discovered penicillin. So penicillin treated many of our grandparents or grand-grandparents. Had they died without penicillin, we couldn't even think of being born. So that's the kind of. So there are a lot of doctors who did wonders. Helen Brooke, founder of pediatric cardiology, father of blood bank, cardiovascular, pioneer in cardiovascular surgeon. Apgar, this guy, inventor of Virginia Apgar, he invented Apgar score. So a lot of, and George Smith, he started treatment for leukemia. So a lot of doctors, had they decided to sit in their clinic and make money or see all their patients, many of us would not have been born even. So they were great doctors. So medicine is a great profession. There are a lot of opportunities in the medical profession itself to do wonderful things. Right? All of you agree with me? Anyone feeling sleepy? If anyone is feeling sleepy, it should be my problem, not your problem. So you can stop me and you can ask questions in case. So, can I have a volunteer to support me? Any volunteer? Volunteer from medical students? Come. You should give a clap for her. Come. What's your name? I'll give you a seat. You are confident to come up. I want to discuss something else, so that's why I asked this question. Sit here. Yeah, you are getting a chair. The most confident person should get a chair. What happened? So, I'm seeing a different picture here. There's some technical problem, they will fix it soon. So I'm asking you another question. So why should a doctor look for other options other than medicine? Why? What's her name? Deborah. Now, if you think that, if you think that doctors can look for other options in their career, why should we do that?
Why we should?
What's the reason?
Right. Because it's not just in medicine that you can contribute. Like there's so many other things you can do.
Yeah.
Oh yeah, sure. There's so many other things you can contribute to with all of the knowledge that you've gained. So perhaps you might not shine just in medicine, but perhaps if you pursue something else, that might be your true calling, and you won't know if you won't take that risk.
Which means no, clinical medicine need not be the only career path, right? That's what she was trying to say, right? So how many of you agree with that? Doctor, some people say, if you are a doctor, you should do only medicine. But some people say that you can choose other paths, career paths. How many of you agree with that? Doctors can, yeah, great. Oh, this is really good. Oh, so this college is going to produce a lot of great people outside clinical settings. So that's what I'm trying to say. See, in the current situation, current scenario, people should think of opportunities outside clinical medicine. I'm not saying that everyone should go for something else. No, nothing like that. But there are opportunities to do things outside medicine. If everyone leaves medicine, there will not be anyone to treat me, people like me or Johnson. So we need doctors. It's a great profession, but there are opportunities outside also. And a lot of newer opportunities. I'll briefly discuss in the course of the presentation. And the other thing is job opportunities for doctors are declining. It's a fact. So there are a lot of doctors so when I finished medicine, there were only 5 medical colleges in the whole state. And 5th one was a very new medical college, Thrissur Medical College. Now we have 40 medical colleges. And we don't know yet whether we want more doctors or less doctors. That's a management issue. That's a planning issue. Doctors like you have worked in the US. So they have their own mechanisms. When they want more doctors, they will produce more doctors. And they will kind of calculate for 25 years or even beyond that. So based on which they will allow other doctors also from other countries to come into their country. But we don't have that kind of planning. And we don't know whether we know. Of course, we talk about this doctor-patient, doctor-population ratio and all. But that's also it's just numbers. I was doing my PhD, I looked into the data. It was shocking to see that 70% of the people live in where? Urban area or rural area in India? 70% of the people live in rural areas. And 70% of the doctors practice in urban areas. So that's the kind of distribution or availability of doctors. I'm talking about modern medicine doctors. Still, so what happens is doctors, generally they want to practice in urban areas where you have a lot of doctors and hospitals and you don't have enough. So I'm hearing stories about junior doctors getting 10,000 rupees per month after MBBS in some of the cities in Kerala. That's the kind of situation. So that's why, that should be one of the reasons why doctors, just because you did medicine doesn't mean that you have to continue in medicine. You have a lot of other capabilities. We are all talented people in many other areas. So you should look for, it may look a bit difficult or look odd when I say such things. And don't go and tell your parents today itself, no, I'm going to do something other than medicine after finishing medicine. You'll be finished, no doubt about it. Even after, when I was a grown-up doctor, as a grown-up guy with MBBS and all, few years of practice, and when the first MPH school, Master Public Health Institution, started in Kerala. The first MPH school started in Trivandrum, the whole country. And I had already 2 children. When I told my father, I'm planning to do Master Public Health, my father told me, why should you do that? I'm waiting for you to become a cardiologist or a neurologist. So that's the kind of situation. That's a reality. And I don't want all of you to take a decision today that, we are going to leave clinical medicine. Nothing like that. So I'm trying to put this idea into your brain. I know there can be future film directors in this group. There can be a movie actor or actress in this group. There can be a politician in this group. There are opportunities. That's what I'm trying to instill into your minds. And we should not miss that point. I was told by your teachers that this hospital, the doctors are given good salary and doctors don't depend on other malpractices or unethical practices for making money. So when there are more doctors than we want, there will be unhealthy competition and there will be unhealthy or unethical practices. So this volunteer can be freed. So any other volunteer? I am checking something. How many of you want? Yeah, you can go. Any other volunteer? We will discuss this point. Yes. Anybody? That corner is really good. Good. What's your name? Dari. Huh? Dari. Please go and take your seat. So what are the career options other than clinical medicine for doctors? You can see that, right? UN. WHO is part of UN. I used to work for WHO. Even now I am in the leadership roles of WHO. There is UNICEF, World Bank, Global Fund. How many of you have heard of Global Fund? Anyone? Global Fund. You should know, as medical students, you should know what is Global Fund. Global Fund money is coming to this district also. Even to the nearest PHC. What is Global Fund? Any idea? Okay, then you should go and read what is Global Fund. So that's the biggest health fund. It's a fund pooled by all the countries in the world. I had the opportunity to work there also. It's a huge funding agency to fund countries to manage tuberculosis, HIV, malaria, these 3 diseases. It's called Global GFATM, Global Fund for AIDS, TB and Malaria. It's a huge funding. So only after the establishment of the Global Fund, this HIV and tuberculosis burden, especially in developing world, poor countries, is coming down. Especially in African countries, HIV is coming down just because of the Global Fund. TB also, malaria also. So you can work there. Doctors can work in the Global Fund. A lot of doctors working in the Global Fund in Geneva. I used to work there. World Bank. Can a doctor work in the World Bank? Why? To disburse cash or what?
To help in assessing the monetary needs for health services that are required by different countries, especially like those who are dealing with epidemics.
So Global Fund gives loans. Global Fund gives grants, some money, no, huge loans. Getting from the Global Fund is a grant. You don't have to repay. But World Bank will give you loan, which we will have to repay. India is also getting World Bank loan, even for health, even today. So, and there, when they give money to a government for health program, they need doctors to plan their program, to support their program, monitor their program. I'm a consultant for World Bank for one of the programs in India. They need consultants also like me. Some people are working there. So World Bank, there can be doctors can work in the Global Fund. Doctors can work in World Bank, UNICEF, international NGOs. You mentioned about, Johnson was mentioning about Family Health International. It's a huge international NGO where I used to work in the headquarters. So there are a lot of opportunities. Then there are areas like public health, which I did, Master of Public Health. Now we have a few institutions. How many of you are sleeping? Those who are sleeping, please raise your hands. So, health economics is there. What is health economics? You can go. Another volunteer, what is health economics? You can stand up and say what. So I want to know how many of you are really courageous. If people are not standing up, people are not raising your hands, I'm really worried. I'll tell you the reason why. So what was the question? What is health economics? Anyone? Try. Any more volunteer for me? So you guys are which year? Is there any final year guy or girl? Nobody is raising. You are afraid of the question. No worries. So there are areas like health economics, health financing. So these are areas where doctors can also move into. So there are areas. It's not just anatomy, physiology, biochemistry. All these are important. But after finishing medicine, you can move into, I'll show some pictures, then you will get convinced. Oh, no, I didn't finish. Civil service. A lot of doctors, after medicine, they do IAS, IPS. Some people say, oh, so they are wasting a seat. Nothing like that. You should try that. Whoever wants to try civil service, you should do that. I'll tell you the reason in one of the slides. Media. Johnson said, I was probably the first doctor to run a regular TV show in 90s. You were not born. Some 10, 11 years. I did some 500 episodes. It was called Pulse. So it's possible. Because before that, somebody who studied MA Economics or BA Politics used to interview doctors. So they did not have the kind of technical capacity to ask good questions. So naturally there was a provision for a doctor to sit with a doctor and chat. So that's how. So you can have. Now, when I started in 93, I was the first doctor. But later, most of the channels started getting doctors to present health programs. Media. There are doctors who are working for media. And politics also. Doctors, and yeah, always. And see, there are a lot of doctors. So earlier we discussed about doctors doing wonderful things in medicine itself or related to medicine. See, there were doctors, no? Russian author. And how many of you can identify this person? Yeah, he was a doctor. Who is this? Maria Montessori. She was an Italian physician. First African-American woman in space. Was a doctor. Comedian. Most of you know, Che Guevara. Doctor. And President of Chile. Just because you are a doctor, it should not limit your kind of opportunities. There are a lot of opportunities. Of course, when you are a doctor, you have some extra advantage. I told you, when you work in an organization, even in World Bank or those kind of organizations. I mean, if you're a doctor, you have some advantage because you know the medical science. But that should not stop you trying something else outside. So you may think that all these are foreigners for us. Huh? So who is this? This, people should know this person. Any guess? Do you remember any name of a doctor who was a chief minister in one of our states? Have you heard of Dr. B.C. Roy?
So many times it has been repeated here because Dr. Chandy sir has got the B.C. Roy National.
Yes, that's why he told me on the way. So he was the chief minister of West Bengal from 1948 to 1962. So a doctor became the chief minister several years, 1 year after our independence. So there's a possibility one of you can become a chief minister. You should try. So I just looked at, I tried to remember, this I did yesterday, sitting in the room. I tried to remember many of my friends, doctor friends, who tried different things. This was Dr. Usha Titus, who studied in Trivandrum Medical College. She took IAS. She studied in Vellore also. Yeah. Recently retired. She's a friend of mine. She's additional chief secretary, Dr. Asha Thomas. Sisters, Dr. IAS. He is our Dr. Venu. You'll see his picture almost every day on the newspaper. Dr. IAS. He's my classmate, Jay Tilak, Dr. IAS. Our health secretary is a doctor from Maharashtra, Rajan Kobragade. And this was junior to me, another Dr. IAS. This doctor is also from Calicut Medical College. He got IPS. And few years ago, he moved into World Bank in Delhi. Dr. Suresh Mohammed. This guy is a very interesting guy, Dr. Nirmal Ravi. I met him in Washington, D.C. a few years ago. His parents called me and told me, our son is there in D.C. We should try to meet him. I will send him to your home. And this guy wanted to do medicine, and he got only engineering many years ago. And he was very upset, but he continued engineering. Then he went to US for his master's in engineering. Then he did his PhD in engineering. But in the US, you can try medicine even after that. Then he took medicine. After all this degree, and he became a doctor. And he practiced for a few years. Now he is the director of, if you check in the Google, he is director of eHealth Africa, digital health. In the field of digital health, he's a super guy. He lives in US and travels to African countries, and he is linked to digital health area. So people from other areas can also come into medicine and need not sit and practice in a clinic. He is traveling all over the world. And Dr. Munir was one of the ministers. Even now he's an MLA. And this person you all know, right? And how many of you know him? Now he is the director of KF or whatever in Kerala. He studied in Trivandrum Medical College, took IAS. Recently he joined Kamala Hassan's party, and they lost the elections, and then he lost his job because he resigned. If you want to contest for elections, you have to resign your government job. But he didn't stop there, and the government of Kerala brought him as KF director and all, in a very senior position. And this is Dr. Kavya, a Malayali who lives in Karnataka. She's a very famous scriptwriter. She's a medical doctor. She stopped practicing after 1 or 2 years, and she's a very popular. Just Google her name, Kavya Ramkumar, very famous young scriptwriter, movie scriptwriter. Yeah. So I just took a few names from my phone list, and you can see all kinds of people excelling in different other areas. They didn't stop just because, I have got medicine, MBBS, I should stop. They tried so many other things. I'm not saying that leaving medical field is the best thing, but there are opportunities outside also, if you want to try. See, 8 Bollywood celebs who are doctors by profession. So, what I'm trying to say is that I saw a few hands raised today when I asked people, how many of you enjoy this course, how many of you wanted. So, a few years ago, I was in a government medical college in Central Kerala. I don't want to name the college. I asked this question, how many of you joined medicine with a lot of interest and still continuing with a lot of interest? Nobody raised a hand. One guy was he wanted to raise, then he saw nobody there. He also lowered the hand. So that was a big kind of education for me. We are not going to those details, but what I'm trying to say is, see, then my speech had a different course in that hall. So I also encouraged youngsters to take different paths. So many students, after that talk, they surrounded me. And one guy was asking me, sir, can you give a call to my parents? Because I wanted to become a film director. He showed me some of the short films he created, but his parents forced him to become a doctor. I told him there are opportunities later in the life also. And somebody else was saying that, I want to do higher studies in pharmaceuticals. My parents want to become a neurologist or cardiologist. So I could also intervene, and now he's doing medicine. He did medicine and then some pharmaceutical course in Ireland. So there are a lot of opportunities. I forgot to put some pictures. One of my friends who was senior to me in medical college, we were all doing fourth year, final year, something like that. His name is Suresh Aravind. He finished medicine and he went and joined MBA in Cochin University. So he was a bright student. And many people were asking why this person is doing MBA after medicine. He's a bright student. He could have done so many other clinical courses. What happened is that after MBA, he joined a medical company, drug company. That was for a few years. If you check his name, Suresh Aravind, he's the global senior vice president of Johnson & Johnson, huge company based in Washington, D.C. or New York or some place like that. So there are a lot of opportunities. So there also you get the advantage of being a doctor, but you don't have to necessarily sit and see patients all the time, all the years. Just because I'm a public health person, I thought of quickly going through some public health aspects also. So anyone who is interested in public health? Anyone? What's your name? Vijay Lakshmi. What is public health? Can you try to say what is public health? Which year are you? Second year. What is public health? What is health? Good. So what is public health? Health of the government. Good. Great. So if I sit in a clinic and see my patients, that's a great job. I treat my patient. That patient gets cured, I am happy. That patient dies, I am also unhappy. How many of you have heard of Nipah? Nipah, yeah, good. So what happened? Did we take long time to control that disease, or we did immediately control? In a few days, right? Why? How did that happen? Is it because there are a lot of public health experts in the state or something else? Somebody sleeping or not? Just thinking something. Started dreaming about becoming IAS or IPS or? So, how could we control Nipah? Because the first clinical doctor who saw that patient suspected of Nipah. He is not MPH or he doesn't have PhD in public health. But clinical doctor had that kind of public health thinking. So if somebody comes to you with fever, if you can give paracetamol in case, if there is any bacterial infection, you can give antibiotics, treat him. But you have to think beyond that patient. So he sent his sample for Nipah. But the lab sent back saying that we don't test for Nipah. But this guy insisted, sent to another lab. So a clinical doctor had public health thinking, and he felt that if this is a disease like Nipah, many people can die, many doctors can die. It happened, nurses died. So that's what I'm trying to see. You can be in your clinic, but you can think of the entire public. Or you can be a public health practitioner like what I am doing. So, a few slides. So what is public health? I ask this question because many people, when I say that I am doing public health, people ask me, oh, did you do PSM, SPM, whatever? Or health education, you go and talk about diseases. You always sit and do research. Many people, when I meet somebody in the flight, they may ask you, what are you? I say, I'm a doctor. What are you doing? Oh, I'm with WHO. You always do research. People think that we are all with pipette and burette and all sitting in Geneva and doing research. Nothing like that. Research is also there. Surveys, epidemiology, field work, working for. So, all these are there. Public health you cannot put in just one basket. No? There are a lot of opportunities, lot of options for a public health expert to work. What is public health? No? You can read the second bullet. Overall, public health is concerned with protecting the health of entire populations. These populations can be as small as a local neighborhood or as big as an entire country or region of the world. So Nipah was a problem local, right? And what's the difference between Nipah and COVID? COVID affected how many countries? Almost the entire world, right? So that's why we call it what? Pandemic. So Nipah we could control there as a local epidemic or local eruption of diseases or whatever, outbreak. But COVID has become a pandemic. So public health can be, see, that doctor who thought about possibility of Nipah, he was thinking of his community. So that's a public health. Or when it becomes, when you get a disease like COVID, WHO sits in Geneva and they are not thinking just about Geneva, for the whole world. Right? So that's what is public health. So there are career options. We have some of these points were covered already. And there are opportunities for international public health jobs. The jobs which I used to do, or there are a lot of other people, Indians and a lot of people from Kerala, working in different countries, working for international organizations, including WHO, UNICEF, World Bank, in different parts of the world. When I moved to US, I found out that some of the heads of some of the organizations are from Kerala. So there are a lot of people working. So I'm not the only person, don't think like that. So I'm among the lot of people with medical degree, MBBS and all, working in the area of public health. So this is the last slide probably. So this is about if somebody is interested to do public health or any career, public health, this is specific about public health also. So you have to find out. No, I'm not just giving a lecture today and going away. No, I am available. People like me are available for supporting you. So there are a lot of people with a lot of experience. This is what we can give back to you and our country. So I'm available. I will leave my phone number, WhatsApp number and email, all those things in case you want to contact me and ask me further questions. So you have to. No, I told so many things, so many organizations, WHO, World Bank, all this, health economics, health financing, different kinds of gender and health. There are a lot of gender experts required in the field of public health. Many organizations, they check for people and they don't get the right person. Logistics management is a big issue. So somebody with medical background and logistics, MBA in logistics, or MBA in finance, very high demand everywhere. We don't get people to recruit whenever we when we are immediately looking for some positions, including international positions. So start visiting websites. As medical students, forget about public health, you should visit this WHO website. You should have done. How many of you have visited WHO website? I expected more hands. You should visit today itself. You should go and check what is there in WHO website. People ask me questions. People see, even educated person. Some of you might have seen me coming on television in TB debates and all. Many friends call me and ask me, Dr. Lal, where can I get this information? Or I got a WhatsApp message saying that this is not a virus. COVID is not a virus. Is it right? I said, go and check WHO website. Don't ask me. So it's for everyone. This is open. A to Z, all this is every information about, available information about every disease or health events are there. So today itself you should do that. Okay. And start establishing connections. If you want to move outside your clinical rooms and do public health or some other things, if you don't have to do it today, but as days go, if you have interest, you should start establishing connections. There are a lot of people like me. You can contact us, you can think of internships and training programs, and so those kind of exposure may make you a better candidate for such opportunities. And so these are some, see, you have to, I give that example. When somebody saw a case, he suspected TB. He suspected Nipah. Those kind of public health thinking you have to nurture. And you have to, of course, you have to improve your communication skills. I am not saying that you don't have communication skills, but communication is not just speaking English. If communication is just language, how can Russians sit and watch Amitabh Bachchan movie? I used to work in a country like East Timor. They are a linguistically confused country. They don't speak English, but they all watch Shah Rukh Khan movie. So communication is not just English. English is, of course, English is an international language. You should know English. And I, as a senior doctor in front of you, I have a good advice for all of you. Whether you go to WHO or choose public, that's a different thing, but try to learn another language. If possible, UN language, foreign language. And I would advise you to, if you are interested, try to learn French. So there are opportunities, there are different mechanisms how you can learn French. If somebody is planning to go to US, Spanish will be better, but try to learn another language. You don't have to finish in 1 month or 2 months, but take your time. And I have given this advice to many youngsters, and they have seen the result also. Knowing another language, especially UN language, and if possible French, that will be a big advantage. If you are going to sit your whole life in your home with your own consultant room or nearest hospital in your town, forget about it. But still it could be useful. But if you have interest for international careers or thinking of working outside your country, try to learn French. It's so easy. There are a lot of mechanisms to learn French. These are some, I'll leave the presentation here so you can look at this. Or you can remember and visit these slides. This is the WHO website, UN website, UNICEF, World Bank, Global Fund. There is one, Relief Web, reliefweb.com. You can remember this, reliefweb.com. So that has all the information about similar jobs globally. You don't have to apply for jobs tomorrow, but you can see what's happening outside. So I'm trying to repeat this because, so doctors, we are trained in a different kind of, we in a conventional manner. People towards the end of the final year, they start thinking of what should I be doing. And then you finish your house ANC, start writing for entrance examination. Some people write for 1 year, try for 1 year. Some people try for several years. And you want to become a cardiologist, and you finally, some of you can become an anatomy teacher, which is it's a great thing, but that was not your passion. That was not where your passion was lying. You wanted to, and you had limited options, and you get frustrated and all kinds of problems. So that's what I'm trying to convince you. There are a lot of other opportunities. Just don't think that you are getting MBBS, because of that you can become only a doctor seeing patients. So I thought I should tell you a few tips also. Many of you may know that, no? Say I'm from Trivandrum city. I had a very modest beginning or small beginning, but there are certain qualities which you acquire from looking at other people or from your teachers or parents or whatever. And you have to use opportunities. Opportunities will never come twice. So you have to use opportunities and you have to grow. So these are some of the points or some of the things that I have learned from different areas and different people. I have worked with WHO, worked with very popular people, very senior people globally. So these are some of the things that I wanted to. There are a lot of things. We have, I take classes, communication manager. We have 1, 2, 3, 4 like that. There are several things. You can see that you have to be confident, you have to be motivated, so many things. Those are textbook items. This is something which I used to learn from some of my seniors in WHO or some of my mentors in WHO. Irrational optimism. So what is optimism, doctor? What is optimism? Just try. Come here. Come here. Be confident. So what is optimism? Yeah, try.
Possible attitude.
Keep the mic. Be confident.
Possible attitude towards like.
We all know optimism, right?
Yeah.
Be optimistic. People say that. Be optimistic. Don't be pessimistic. Be optimistic. So what is irrational optimism? Can you go to moon? Why not? The normal course, you have plans to go to moon? No. Can you go to moon? No. Can you try to go to moon? No. We all just dismiss at that level. But if you think that somebody will be going to space, from here, from Kerala, that TV, Sandosh. So that is irrational optimism. You ask, can you go to space? No, I cannot go to space. But if somebody wants to go to space, there's an option. So that's what I am trying to see, rational optimism. I'll explain it with some pictures. Okay. So what is schizophrenia? What is it? What is schizophrenia? Is it an illness? Senior students. It's a mental illness, right? It's a major mental illness. So what is it? You talk about split personality and all, right? Same person will be behaving in two different ways. So, which means so it's a split personality, and I'm going to the clinical details of that. So schizophrenia is a serious disease. But if you can be creatively schizophrenic, which means you can play different roles, but those are creative. Those are useful roles. And perseverance. I don't have to tell people what is it, right? Don't give up. And avoid unnecessary fights. I tell people, what we see every day in any organization, we have to resolve fights. Unnecessary fights. And in our place also, we get into unnecessary fights. Just leave it there. Don't try to. You have to choose your fights. There is a TEDx talk which I did. You can watch 10 minutes. You can just Google Dr. S Lal TEDx. So I talk about such things. Certain places you have to fight. But you have to pick your fight. You have to choose your fight. But what happens is we get into all kinds of unnecessary fights and we waste time, a lot of time. So one of the medical colleges, somebody asked me, so how did you reach WHO and all? So what I try to say is that, see, when you have a race, you have to run. But what happens is some of us do like this, we will not allow the other person to run. So in that process, all of us get slowed down. So don't get into unnecessary fights. Use time very productively. So these are some of the things I wanted to. But I'll be coming back to this institution. We can have detailed discussions about these things on a later occasion. So this is what I am trying to say. When I first heard of Shashi Tharoor, I thought I'll not be even able to meet him in a 10-meter distance because such a person, big person, Under Secretary General, contesting as UN Secretary General. But I had irrational optimism. Optimism will alone not take you to places. We have to work towards that. So many years ago, this is one of the conferences in Canada, Ottawa, I think. So I used to look at him as a person whom I can never reach. But if you really work, if you have that irrational optimism, you will reach a stage when you can sit with him. That's what I'm trying to say. So what I'm trying to say is not from textbook. It's not my textbook knowledge. This is something which I experienced myself. I practice myself. So this is my creative schizophrenia. Somebody told I was a student leader. I was a college chairperson when I was a student. I studied medicine. 30 years ago, I started a TV show. It's a very old newspaper. This was shooting up some newspaper. This was sent to me by one of my friends recently. So I was practicing. I had my own clinic. I was working with Mr. Johnson, but I did a television show. This is my UN part of work. And this is the release of collection of short stories which I wrote. Being a doctor didn't stop me from continuing to write short stories. So DC Books published my collection of short stories. So I was a candidate in the last assembly election. I lost, but I was a candidate. And this is my PhD function. So all this, what I'm trying to say is, you can try different things. I did my PhD when I was a full-time officer, global director of infectious diseases with tuberculosis portfolio and all, looking after several countries, living in Washington, D.C. And I did my PhD from Europe. So a lot of things are possible. And you never confined to one particular area. Oh, I started medicine, I should be doing only medicine. You can try different things. That's why I said, I am not from a big place, big home, nothing. I am from a small city, I am from a small home. And I asked for volunteers. I asked that because of a purpose. 2 or 3 people got up and came to the stage. So what prevented others from raising from your seat? Be honest. Can somebody say that? Why didn't you stand up? Or why didn't you come to the stage? Green. Sorry? Yeah, use the mic. Come forward. This is my last point which I want to discuss. Why didn't you get up when I asked?
Sir, it's been hesitation in front of a lot of people to speak.
Exactly. Very good. Stay there. So hesitation. Why is there hesitation? Why is there hesitation?
Not in a habit of speaking in front of.
Yeah. So that's, I was also like this. Of course, I was student leader and all, but I also had hesitation. But you have to overcome that, no? So nobody told you to sit there, oh, don't get up. But somebody inside you was telling, no, don't get up, don't get up. This guy could call you to stage, can ask some question, I may. So this is kind of, so you are stopping yourself, right? So next time when I come, there should be more volunteers. It's not a magic show or something like that. I'll be called to stage and asked to do something funny, But I was testing how many, this is something which you have to overcome as a college. So I was introduced so well, and all of you know that I'm a doctor. I'm a harmless guy. But we should have that kind of, this is something which I teach my interns also. I know people who have asked a question after a presentation just because they've got up. And I also have noticed so many faces today. See, some people look at you. Some people listen to you. Some people interact with you. Some people, they will have a lot of benefits, no? I know people who got jobs after going and discussing with the presenter, because he was also looking for smart guys. So don't hesitate. No, this is part of our culture. When I used to work in Delhi, I remember this. I'll end with that joke. I used to work in Delhi as a national officer. So I used to see that, when we have a big group from different states, people from South India, they tend to sit together and they will take a seat far away from the dais. We have to overcome that. We have to overcome that. And somebody is presenting, if I look at somebody, that table, if it is South Indian or Malayali, they will all start looking like this. They will not establish eye contact. This is something which we should be learning from other parts. Some people are very confident, some states, they are very good. So there was a function, international function, and one of our directors of the national program was speaking in front of hundreds of people. A lot of people from other countries, international audience, and he was giving a good speech. And he was fumbling for words in between. And he will say matlab, English speech. He will say matlab, key, all those things. So people who don't have the capacity or capability of giving a good speech in English, they also come to stage and they show that. So which we have to learn from some other parts of this country. You should have that kind of confidence. If I call you, you should be confident to come up and talk. So 2 or 3 people who came today, I'm really happy about you guys. And so that's my presentation. I wanted to have this kind of different discussion because I can talk about public health, I can talk about vaccines, I can talk about COVID, but this is something which many people will not be able to tell you. Even I didn't know these kind of things before I went outside the country or outside the state. So I've gone through this kind of experience, and I know these are some of the areas where we need improvement, where I have to throw light so that people can see that. How many of you knew that? How many of you knew that doctors can work in World Bank? Please raise your hands. Nobody knew. And tell you, see, we have unethical fights for patients and scan commission, all kinds of things, and you will be caught by police, media will show you a picture. See, these organizations, they give good salaries. So there are opportunities outside. If you are looking for settled life and money and those kind of things, that's also available outside clinical rooms. I'm not saying that clinical medicine is not bad or anything like that, but there are opportunities. You should be aware. And there's an opportunity for you also. From today, you can think of such opportunities. You can search opportunities for doctors outside medicine. Or you can interact with people like me. You can call me, you can email me. And if you want, I can type my email here. Oh, it's not working? It's in the slideshow. Disappear. No, it's fine. I'll leave my email and everything with the search. So, if you want to ask any question, I'm available here.
Any questions? Anybody want to ask anything?
You can ask for clarification. If you didn't understand something, you can ask that. I can discuss it further. Same principle is working. You want to ask, but they are not very.
So I wanted to ask you this from the very beginning. When you spoke about working in different places, and then you came back here, was it ever emotionally exhausting for you to see how differently things work here, or how unfair sometimes certain things can be?
That's a good question. For me, what happened is, I was working outside, but I was frequently visiting India and Kerala, my state. So I was in constant touch with my people. That's why I became a candidate. After 20 years of separation or 20 years of living abroad, I could come back and stand as a candidate. So that I was doing. But what you said is right. The whole world is changing, not just our place alone. So if you visit a country after a few years, any country, there will be changes. Cultural changes as well as so many other infrastructure, a lot of changes are there. So I wouldn't say that no, my country has changed or so. This is, you cannot stop it also. So of course there will be interventions, governmental interventions, social intervention, those kind of things are there. Recently I heard about somebody saying that drug menace is a huge issue among the young population of students, which I am not sure, but these kind of things will be there. So there will have to be different kinds of approaches. As an individual, I'll have limitations. But of course, things have changed. Things have changed. But especially when you come back from a developed world, developed country, you find it difficult to adjust in the first few months or years. You know, we waste a lot of time for unnecessary things. Your power goes, and you call someone. He says, "Power will come in 5 minutes." Doesn't come in 5 hours. You call someone, he'll say, "I'll come, be there in 5 minutes." He will not come for 2-3 days. So these kind of smaller things. This is the problem with all developing countries. So our country is better. So some of the countries where I worked, the whole country was running on diesel. So power was produced by diesel. So these kind of issues are there. But we are improving. But yeah, see, life is very competitive and resources are limited. So that will affect how we behave also everywhere.
So,
Yes.
so you had asked all of us how many of you are interested in public health a while back. So I know, like, I'm a final year student. So if I were to ask my classmates, most of them are interested in clinical medicine, like 90% at least. So because I think they have an exposure towards the scope of, because we are in the hospital all of the time, we know what clinical medicine is. And if I am interested in public health. So if I were to ask them why not public health, it is due to the lack of exposure is what they would say. So how do you think we can increase the exposure of the scope of what public health or a person would do within our education system, the current medical education system? Because I think that is kind of lacking.
See, why we become doctors, it's not because, I can tell you. See, all the reasons I stated. We want money, we want to be settled, we want job security. This reason. Of course, I was passionate about doing medicine. I want to do it. But that was not the only reason, because we had several other reasons. And we all think about a settled kind of safe life. We didn't want to take any risk. That's why the son wanted to become a film director, but parents, they don't want him to become a film director because they are worried about his future. Whether he will get movies, whether his movies will be successful, whether he will make enough money. So always passions are prevented, not because parents are bad, not because parents hate this child. Parents are, we are not a rich country. Our resources are less. We don't have much options. If you are a doctor engineer, you will survive. If not, you will have problems. This is what is leading us. So same is the problem. Public health, we don't have much exposure. You are a cardiologist, neurologist. It doesn't mean that you want to treat all neurology problems in this world or all cardiology problems in this field. We know that the doctor who drives a Benz car is a cardiologist, or Audi is a neurologist. So you want to be in that group. So it's to be on the safer side. That's why I'm trying to say, if money is not the, even in other areas, World Bank, look at the salary of a World Bank doctor. Or look, you can also Google the salary people like me used to get, which we are not aware of. And I used to get tax-free salary. All the money I used to get as a UN doctor, WHO doctor, I could take home. No tax was deducted. If I say pay some bad tax for buying something, that is also reimbursed. We all need money. We all need money, but becoming a kind of non-clinical doctor will not reduce your earnings, or in many cases it will increase your earnings by several fold. That's what I'm trying. So basically people don't want to try anything else because there is a set pattern. If you are a cardiologist, if you are a neurologist, your life is better. Your life is safe. That's the reason. Because we are poor people, that's why. So I'm seeing a lot of boys, even though there is bright light falling on my face, so boys are not asking any question. Yes. Good.
I just came to know you joined politics.
Yeah.
I want to know what led you to that.
See, politics, see, of course, politics is there and there is party politics. So I'm in politics because I want to contribute.
Like, it's very rare for a doctor to go for politics.
It's not rare. That's why we had a chief minister who was a doctor. What I'm trying to say against safety. If I'm in politics, I lost the election. So if I'm entirely dependent on politics for my survival or for my, then I'll be careful. I lose the election. I'm not an MLA. I don't get money. That's the kind of. So many countries I've seen. When I used to live in Switzerland, even the president of that country used to come and sit in a kind of restaurant and eat food. Nobody will know that he is the president of the country. Because many countries, their politics is not the primary job. It's not a job. It's something that they do outside the job. So I'm working. I'm a professor. I do consultancies for UN organization and I have involvement in politics. So, which is also contributing to the country. Unless you are, if you are part of a terrorist organization or something, that politics is bad, whatever be it. But if you are working for a national recognized party, you should contribute to the country. You are contributing to the country. That's what. And I used to be a student politician. That's why I had that passion. And people knew me. That's why when I came back, they brought me back to this thing. So politics is good. See, if I hate people who are saying that politics is bad. Politics is bad means, if you are saying that politics is bad, you don't love the country. You want MPs, you want MLAs, you want Prime Minister, you want Chief Ministers, you want Ministers. And we are a democratic country. All these people are elected through a democratic process. Democracy means there should be different opinions. And different opinions in different parties. So that's what party politics. If somebody says all parties are bad, he doesn't know anything. He is not interested in the country. If somebody says, oh, all parties are bad, then you start a party. I'll join you. So that's why I joined politics. Thank you. I hope everyone can speak English. No, you can ask me question Malayalam also if you want. എൻ്റെ മലയാളം നല്ല മലയാളമാണ്. മലയാളത്തിലാണ് ഞാൻ കൂടുതൽ സ്ട്രോങ്.
ഗുഡ് ആഫ്റ്റർനൂൺ സാർ. സാറിനറിയാം ഈ ഡോക്ടേഴ്സിന് എഗെയിൻസ്റ്റ് ആയിട്ടുള്ള വയലൻസ് എല്ലാം ഈ ഇടയ്ക്ക് ന്യൂസിൽ ഭയങ്കരമായിട്ട് കാണാനുണ്ട്. ഒരു 2 വർഷമായിട്ട് അത് ഭയങ്കര കൂടുതലാണ്. അപ്പോൾ അതൊരു വലിയൊരു ഡിസ്കറേജ്മെൻറ്റ് തന്നെയാണ് യങ് ഡോക്ടേഴ്സിനും പിന്നെ വരാൻ പോകുന്ന ഞങ്ങൾക്ക് പോലുള്ള ഡോക്ടേഴ്സിനും. സോ അതിനുള്ള സാറിൻ്റെ അഭിപ്രായം എന്താണ്? സാർ അതിന് വേണ്ടി എന്തെങ്കിലും ഇനിഷ്യേറ്റീവ് എടുത്തിട്ടുണ്ടോ? ഉണ്ടെങ്കിൽ ഷെയർ ചെയ്യാം.
എനിക്കതിനകത്ത് ഒരുപാട് വ്യക്തമായ അഭിപ്രായമുള്ള ആളാണ്. ഇപ്പം ഞാൻ വിശ്വസിക്കുന്നില്ല ആളുകളെല്ലാം മോശമായതുകൊണ്ട് നമുക്ക് തല്ല് കിട്ടുന്നു, ഡോക്ടർമാർ തല്ല് കിട്ടുന്നോ, അല്ലെ ഡോക്ടർമാരെല്ലാവരും മോശമായിട്ട് തല്ല് കിട്ടുന്നോ എന്നല്ല. ഇത് എൻ്റെ ഒരു സെപ്പറേറ്റ് ടോപ്പിക്ക് തന്നെയാണ്. നമുക്ക് ഈ പലപ്പോഴും തുടക്കത്തിൽ തന്നെ പറയാം, ഈ കമ്മ്യൂണിക്കേഷൻ പ്രോബ്ലം ഉണ്ട്. പലയിടത്തും വഴക്ക് നടക്കുന്ന, എപ്പോഴും അങ്ങനെയാണെന്ന് പറയുന്നില്ല, പലപ്പോഴും വഴക്ക് നടക്കുന്നത് ഒരു കമ്മ്യൂണിക്കേഷൻ ഇഷ്യൂവിൽ തുടങ്ങുന്നതാണ്. അത് യാഥാർത്ഥ്യമാണ്. പലപ്പോഴും ഒന്ന് മെച്ചമായിട്ട് പറഞ്ഞിരുന്നാൽ sorry, I switched into, hope all of you can follow Malayalam. Okay, sorry. So, what was the question? Sorry, I forgot the question. Yeah. So I don't think that, doctors are being beaten up because people are bad or doctors are bad. So this is due to different reasons. Many cases, these fights happen because of communication gaps. And as doctors, we are not properly trained in communicating. I can give you an example also, funny example. One of my classmates, it's a story about him. So he told someone that, no, people who are diabetic, when they pass urine and they leave that place, ants will come because there is sugar. So this kind of he got some idea from somewhere. So he asked an old patient, do ants come when you pass urine? He said, no, only urine comes. So he was angry. No, how can you? He asked in Malayalam, the way he asked, Mutra orikkum urumbu varuvo? He said, endu chodiyam Mutra varuvo? It was like that. So the way you communicate. So it has a lot to do with your communication. See, See, I lost my mother 1 month ago. I went through all the processes where doctors behave properly, very well, and misbehaved also. I have my own personal experience. Actually, if I were not a doctor, I would have beaten up that doctor. So that is also there. So all doctors are not equally good. We are not properly trained in communication. Everyone is not equally committed. And when somebody, if someone close to me dies, so I'll be in the most, I'll be the angriest person in the world. So we should be equipped. See, we are frontline people, working with all kinds of problems. People with diseases, they are angry, they don't have money. It's like joining the army. I'm the army, but Pakistan should not shoot at me. You cannot say that. So people are there because they are angry, there are a lot of problems. The other thing is you have to have legal measures. I have seen some people, local leaders, they want to show off in front of others, so they go and break the hospital. Those are criminals. These people don't belong to any party. This time could be Congress, next time it could be Communist, next time it could be BJP. So those are criminal people. They will do all such things everywhere or anywhere. So they should be handled with legal measures. So we, as doctors, we should also not think that people are becoming bad or we are all good people and people are beating up. Nothing like that. See, look at somebody who goes and, creates a lot of damages or demolishes a hospital. Somebody from his family or his cousin or uncle will also be a doctor. It's not that doctor is one community and people are the other community. Nothing like that. There's no debate like that. There are bad people everywhere. That's why I said I had problems with a doctor who treated my mom. I was really furious. Really furious. He was a neurologist. He was supposed to go and meet my mom. And nurse told me, she died 1 month ago. The nurse told me your neuro consultation is done. I asked the maids who was taking care of my mom, she was just transferred from the ICU. They said he was standing on the kind of door and asked, how is she? See, she needed a neuro consultation. So I called the doctor. He said, I just got recovered from COVID. That's why I didn't touch the patient. I said, how can you say that gave a neuro consultation and I saw the patient? How can you write that neuro consultation is over without touching the patient? These things happen. I said, if you have COVID, tell another doctor, or tell me I cannot go. So these things happen from outside also. I will see no attack on any doctor. Forget about doctor. Attacking another person is illegal or criminal. You can do that. But we should know that people are in front of us. Nobody comes for tourism to this place. They come here when they have heart attack. They come here when they have stroke, when they have cancer. So see, think about yourself. When you go to hospital, are you very happy? Oh, I'm going to hospital. Nothing like that. They have all this. They don't have money. They have all this stress. Your father is in the hospital. He is putting his 2-year-old child in the neighbor's house. You don't have enough money. All kinds of problems. People come to us with all kinds of problems. We have to think like that. Then try to learn communicating. Don't ask funny questions. See, I can give another example. When we were doing house ANC, so a sick child was there and she was really serious and Panchayat president came. So this Panchayat president repeatedly asked the house surgeon, can I give a banana to this child? She's covered with mask and all. So this Panchayat president means, no, he's a very popular guy. He came from all the way from his village to show his child's relatives that I am concerned about you. He's worried about votes. He's responsible. And he wanted to get into the ICU. And he wanted to give a small banana to the child. The doctor said, instead of telling him, no, you cannot get inside or child cannot eat, he asked, are you trying to sell banana inside this hospital? So, which was a kind of insult. So he started fighting with the doctor. So these kind of simple things, so you have to think of from their side. A Panchayat president may not be as literate or as educated as us. He has his own political interest. He has to satisfy his voters. And he may come and ask, can I go and give a banana to the child? You have to tell them that, child is in a very sick stage. She cannot eat anything. We cannot give banana. If you want, you can just go and see the child and come back. That could have created a different kind of situation instead of beating the doctor. So that also we have to learn. So there is no team of people who want to beat the doctors. Nothing like that. So how many of you have all family members are doctors? Any of your family? In many of your family, you are the first doctor, right? Rarely all of them are doctors. But so we are part of the public. We come from similar families. We come from such families. So don't never ever think that there are people who want to hit us. They are bad people. They have to be dealt with legally or with the help of police or court or whatever. You have questions? More questions?
Any more questions?
Done? Thank you very much.
So we can give, already you have given a big clap to Dr. Lal, that's good. And we have, I'm sure that you all will agree that we had a different type of session today. And I'm sure that in the next sessions, definitely we are going to hear more questions, more people will coming up with hands up. Can we expect that from your next meetings? So one thing, while sitting here, I was just thinking, because as you all know, we have started this National Resource Center for Non-Communicable Diseases. We want to start a regular program now, something to motivate you and come to the forefront. Because we have got 12 departments inside our resource center. And we have already asked students to be part of any of these departments according to your passion. So it's open, it's still open. And we want everybody to be part of one of these departments. Definitely it will benefit you, because this is a unique center not only in this country. I don't think whether there is anywhere in the world. That is where the WHO experts who came here was sharing with us. You've got a lot of opportunities now here. We want all of you to be active, more proactive, and to be well aware of the situations, systems, about WHO, about the various UN organizations, the scopes, potentials, and we all want to see that you have got a wonderful future, and you should feel that all students studying in BCMCH is getting a better opportunity from others. This is, I think this is a challenge which you put forward to us, because for me also everything is new for me. So I'm also learning from this situation and this institution, because I'm also here a new person, came for treatment and being part of this institution and this structure. Okay, so I don't think, I think the time is already going to be 6 o'clock.
Really good.
Yeah.
I want to congratulate you all for listening to my presentation. This is a very different kind of presentation. So I was looking at each face, except one or two people. You were looking at me and listening, trying to grasp something. So that is really good. So I have not seen such disciplined kind of students sitting after the classes. So I really liked it. Thank you.
Before we go to the vote of thanks from Daddy, we would actually, Sir has given us some insight on how to think just beyond the patient, not only the community, but be part of policy decisions, policy making. Can we just put our hands once more? And thanks, Sir, for this wonderful presentation. May I request Johnson, Sir, our Executive Director, National Resource Center, to present this moment of appreciation to Dr. Lal.
He's going to come back again and again. Don't worry about that.
Over to you, Daddy.
The best and beautiful thing in the world cannot be seen or touched. They must be felt. Thank you is one such prayer among them. Respected dignitaries on the dais and everyone gathered here, it is my privilege to propose the vote of thanks today. First and foremost, I thank God Almighty for showering His blessings upon us and making today's program a resounding success. I consider it my great honor to be able to thank Dr. S Lal sir for sparing time from his busy schedule to join us today. Personally, Dr. Lal sir's name is not an unfamiliar one for me because my mother was his junior in Trivandrum Medical College, and he inspired my mother to join the MPH program and pursue a career in public health. So, Pyari. Yes. So thank you, sir. I'm sure that today's session will inspire many young minds here to seek out more exciting paths that are less frequently embarked upon by medical students. So thank you once again, sir. I'd like to express my sincere gratitude to Mr. Johnson Idayaranmulla, sir, Executive Director, National Resource Center for Non-Communicable Disease, for moderating the sessions today. Thank you, sir. I would like to thank Mr. Ashok for joining us today. Thank you, sir. I express my heartfelt thanks to Reverend Father Thomas Varghese Achin for blessing this program with his prayer. Thank you, Achin. It is my great pleasure to thank Dr. Jomsi George Sir, Medical Superintendent, Believers Church Medical College, Additional Vice Principal, Believers Church Medical College Hospital, for being an indispensable part of this program. Thank you, sir. Let me also extend my thanks to Dr. Abel K. Samuel Johnson, sir, Vice Dean Undergraduate Studies and Assistant Director, Believers Church Medical College Hospital, for welcoming the gathering today. Thank you, sir. May I also wholeheartedly thank all the audio and visual technicians for making today's program a success. Last but not least, I thank all of you for your patient listening and participation in today's session. Thank you all. Thank you.
Her mother is a great friend of mine. And a bright lady.
The program has concluded. We can disperse now. Thank you.